Welcome to our Pharma Roastmas. Today, a doctor is going to unwrap his inbox and tell us about the terrible mistakes that pharma are making when they're sending emails and doing social posts for healthcare professionals. Welcome, Tommy Perkins. He's an NHS GP, and he's also founder of Medics Money, has a great community of thousands of engaged doctors in the UK. So one, he knows what he gets when he receives a pharma email, and he's receiving lots of them. And secondly, he knows how to please a healthcare professional audience and keep them engaged. So welcome, Tommy.
Yeah, thanks for having me back, and thanks for inviting me on for this festive email roasting.
I'm super excited, and there will be a positive message because we will be trying to help you all do a better job of supporting doctors with your content. All right, so let's dive straight into it and start with emails. Emails are a great way to assess content because you got to get them opened and you got to get them clicked. So let's dive into some of the emails that you've been receiving, Tommy, and see what you make of them. So talk us through this subject line.
Yeah, so these are actual emails that I've received into my NHS inbox from pharma companies recently, right? So this one's from September. And I've put the first rule of email because at Medics Money, we've built a true omni-channel audience, but across podcast, across SEO, but we also have 70,000 verified doctor email subscribers, which is quite a lot. Sent 1 million emails last year, open rates 50 to 60% at least, and click-throughs 2 to 7%. So doing that is quite challenging, and we've learned a lot along the way. And as Dan said, this is a positive message. I am not here for fun. I am here because I want pharma to be able to communicate with doctors like me better, because you have amazing products which help our patients, but your emails and other communications could be better. So this is an actual email that came into my inbox. And I just wanted to ask you, Dan, really about this, because the first rule of email is the subject line, okay? It doesn't matter what's inside the email. The first challenge is get someone to click on your email. And this subject line has the date in it. And I see this a lot from pharma emails, and I have no idea why, because the date in a topic line of an email is unconventional. And I guess it worked for me because I was just like, who the hell has put the date in an email title?
Right.
But I don't think this is going to get doctors to click or open this email. But I don't know. I see it all the time. I see it a lot. Why?
Well, two reasons that I can guess at. The usual reason for anything being terrible is compliance, so fear of doing something wrong. The only reason I can think of that someone would add a date was because they need to demonstrate that this content has an expiry. Just shows lack of understanding of basic engagement. There is going to be a date on the email anyway. So the email is received at a certain date, which demonstrates that that was the date that it was sent. So if that was the reason for doing it, which I think is highly likely, then the alternative is that they're just trying to showcase the date for some reason. I don't know if it's an event or something, but again, that's not the reason you would engage because of the date. So I can't see what the rest of that is. I don't know if you know what the rest of it was, but was the rest of the content good?
I honestly can't remember, which is probably part of the problem, right? Because I was so enraged by this title, I was just embarrassed for them.
Yeah.
But I think it's also a really important thing to demonstrate is that there are some specifics about NHS email that you need to be aware of that make it challenging for email marketing, which is what we're talking about. So first of all, the way that the inbox is structured, the titles are really short. I don't know if you're familiar, but NHS email runs essentially on Microsoft 365. So if you look at your Outlook, if you have one, the emails are not like in a list, like in Gmail, for example. The titles and the emails are on the left-hand side, and it's really truncated. So you actually only have like 60 to 90 characters that will display in the inbox. So you should treat those 60 to 90 characters like absolute gold that they are. And if you fill those 60, 90 characters with something that makes me curious or makes me think, oh my goodness, I got to open this email right now, like urgency. So I like simple frameworks. So I use the curve framework. So it needs to be curiosity, urgency, relevance to me, like target me. I've told you who I am. I'm a GP. Send me stuff for GPs. Offering value, that's the V. And final one, not used that much, probably for a good reason, is evoking an emotion. So you've got 60 to 90 characters, which is less than a normal inbox in NHS email. Use it well, and we're going to see a few more examples where it's not used that well, unfortunately, today.
Yeah, great advice and good to know. I mean, the technical thing is really important. Just even the thing with the date and knowing how things line up, like the character lengths is super important, but also great tips. And I always also say, like, treat it like a headline, like a newspaper headline. People spend a long time writing headlines because you need to see that on the shelf and pick it up. That's what you got to do with your email. So let's have a look at some more and see if we can give some specific advice on how maybe we could do it a little bit better.
Yeah. So why ADHD? Why should ADHD matter to you? What do you think about this one? I mean, because I put it up here.
Compared to the other examples we're probably going to show, this is pretty decent. At least it's a question. Maybe if you if you happen to have a specific interest in ADHD right now, or you've been reading about it, or you've seen some patients with it, then maybe that's something that's going to stand out to you. My preference is more to try to demonstrate a little bit of the reason why, or have you missed something, or have you seen something? Maybe make the question a little bit more specific with a situation that you might see or might occur with you. But yeah, it's not too bad for ADHD at this specific time if it's a challenge for you.
Yeah, and ADHD is big right now for GPs. And actually, the content here was linked to some educational about ADHD, which was actually pretty relevant to GPs. It was pretty good. I agree. I just wonder, like, we're getting into real neat minutiae here, but that is what subject lines are. They are minutiae. And I don't think anyone's doing any A/B testing. But if I was going to A/B test this one, I might just put, like, why ADHD should matter to you. Because then you just stack in, just get the focus of the email, like, within the first 10 characters. And the focus of this email is ADHD. I'm scanning my inbox. I've got thousands of emails. I see ADHD. I'm like, oh, yeah, I'm interested in that. And then I go, why should it matter to me? Yeah, all right, fine. I'll have a look. But I think this one's all right. We're going to see a lot worse.
Yeah, I think, I mean, I don't know. I like to do things a little bit like push the boundaries a bit. Hopefully there's some sort of insight that you didn't know about that you could leverage. I also would say, like, personalization is pretty good. I know people like to use names and stuff. First name, not necessarily always the best way to do it in the subject line, but using the institute or the place. So if you have I know how long, obviously NHS trusts are sometimes long, but for example, if it says something like Adam Brooks GPs, identify key ADHD symptom or something, right? That might be something that you sort of think it's associated to you and you could link through to it. I've had a lot of success with using that type of personalization to encourage people to open that and look at it.
Yeah, and I think, like, personalization can be overdone, like your first name in the subject line, a bit creepy. But if you know I'm a GP and you know where I am, because I may have told you where I'm based, like, try to use that personalization data in a non-creepy way. I agree. Like, personalization is just like the basics of emails, and it's not getting done that much by pharma.
Right, exactly. Okay, so let's have a look at this.
Oh, okay. This again is here because it's enraged me. Because you may not know that Levemir insulin has been discontinued, or is being discontinued. So this is a massive deal for GPs right now. Like, a lot of our patients are on Levemir. It's being discontinued, and we're like, what do we do? This is a big problem. And then this topic line says, responding to the discontinuation of what? The L is Levemir. So again, you've got 60 to 90 characters in the inbox, to show up and get me to open this email. Put something relevant in that first couple of words, not responding to the. It's just like, there's 3 really useless words there, responding to the, like, pointless words. Like you say, think about it like a headline. And this annoyed me because this actually, again, contains some great advice on what to do if your patients are on Levemir, right? So this is relevant for all GPs right now. The content inside it was good. We're going to look at the structure of the email in a bit to show why the structure, not just the title that had a problem this one, it was a structure. But yeah, another terrible title. And if the title's terrible, people are not going to open it.
I mean, obviously the character limit is challenging with the big words, but something to the effect of Levemir discontinued, what to do? Question.
Levemir stopped. What next? Or Levemir cancelled. What next?
Right. Like, this is just 30 seconds of ideation, and for a headline that you're spending a lot of money on sending to content, like, you could spend more than 30 seconds thinking about the email. This has gone through probably 10 rounds of approval as well, and it's come out this way. So
yeah, but I think, like, pharma could learn from, like, the industry, email industry as a whole, because at Medics Money, when we're sending an email, we don't just do a 20-second brainstorm like we're doing now. We sit down, we run, like, what we think are the best options. We have a meeting about it every week and we're all brainstorming it, and then we run A/B tests. If it's a really important email, we often would use a title of a social post to test an email title, because the great thing about social is you get amazing feedback on what's working and what's not. So I've got 70,000 email subscribers. They are really precious to me. Social, I can run a really cheap experiment on what title is best. And then within a week, social tells me what title is performing best on social. Feed that into the title. Like, the title is 80% of the game, and yet we're not seeing it. And I don't see any evidence that pharma is even doing A/B tests here, which is, like, absolute basic, an A/B test. Like, if you don't A/B test, you are never going to improve your email.
I think the key thing here is what you said about social posts and having those meetings is because this email, for example, and the ones that you've just shared will be the one email that they send in the last 3 months. What I always say for content marketing, actually what you guys are doing a lot of, is like to think like a publisher, not like a marketeer. So you're thinking like a marketeer in terms of your analytics, but the way that you're producing content is like a publisher. You have a periodical every month, every day, every week, whatever that periodical is, and you're testing. You have a short feedback loop, as you said before, and you're able to understand what's working and what's not working. Pharma isn't doing that because it's a one-off email. It goes into the ether. Once it's sent out, it's done. They'll analyze those results 2 or 3 months later. By that time, they've planned the next one and it's just been forgotten. So I think that's the big message, is that you should be testing and learning your craft as a marketeer in a safe place. And emails are quite an easy way to do that if you send regular emails to keep testing. Next, CPD accredited podcast.
So podcasts have been pretty big for Medics Money. We have a niche podcast about doctors' finances, and we've gotten over 1.5 million downloads now, and consistently in the top 10 most popular podcasts for doctors in the UK. So we know a bit about podcasts. And then I look at Pharma's podcast strategy, and it really confuses me. So again, this is a terrible title. Like, what is this podcast about? And is CPD accreditation the main thing on my mind when I'm thinking, should I listen to this podcast? Probably not. First of all, I would like to know what the title is. Like, what is it about? And I have no idea. Like, I know it's a podcast. I know it's CPD accredited. It could be about complex joint replacements in orthopedic surgery. And your email targeting is so poor, even though you know I'm a GP, and I've told you many, many times, and I've clicked on loads of content for GPs, you're still blasting me with complex joint reconstructions relevant to orthopedic surgeons. So just the title's terrible. But then I thought, wonder if we could talk a bit about, well, let's talk about podcasts in a minute, because I want to talk about the formatting of emails next. I've got 2 examples where formatting.
Let's look at that. I think to your point on this, just to give some insight from the other side, I can see what happens here is like there's going to be excitement about doing a podcast. It's not something that they would be regularly doing. So they've got a CPD accredited podcast. So this is a cool idea, podcast, CPD accredited, which their market research will tell them that healthcare professionals like. And so therefore, the key thing for them is that this is a CPD accredited podcast. So they've put that at the front. But the issue is they've led with the channel and assumed that I'm someone who receives this email. I love podcasts, so I'll listen to anything. I'll open this. So obviously you should be leading with what the subject is about. Most people aren't just, I like podcasts. Yeah, they're into a topic, and if there's a good podcast on the topic, they'll listen to it, right? So I think that's the key thing. It's just leading with what is the value add rather than the actual format. This is quite a typical thing that Pharma might do.
Yeah, I think they're asleep at the wheel on podcasts, because podcasts are massive. Loads of doctors listen to podcasts. And yeah, I don't see that many great podcasts from Pharma. And maybe we should skip to slide number 9, which is I've titled Mixing Media (brackets podcast fail). So podcasts are great. You can listen to them when you're at the gym, on a walk. Commuting is a big one for us. We see spikes. We literally know when doctors commute based on the times that they listen to our podcast. But how many times have you been scrolling your inbox at work, in the middle of the office, or for me, in the middle of a GP surgery, and I get an email about a podcast? I'm like, yep, I'm going to listen to that right now. I'm going to stop clinic and spend 40 minutes listening to a podcast. So here's an email that I got about a podcast, but the only way to listen to it was inside a web-based browser, which would just mean I would have to stop my clinic and listen to the podcast. I'm not going to do that. If it's convenient for me, I might go to the show page, think, yeah, that sounds interesting, and add it to my player feed to be played later, like I do for Podcast Right? But I'm not going to stop clinic and listen to a 40-minute podcast. And I actually did listen to this podcast. Eventually, I managed to get it. It took some persistence. And again, the content is actually really good. It's a really relevant thing. But it's just not understanding. And you guys talk about omni-channel all the time. And this is not really the way to do omni-channel, because you haven't thought about it from a user perspective. Like, I am not going to stop clinic. You're not making it easy for me to listen to this podcast. In fact, you're making it hard. Now, I think you're going to say that it's regulation reasons, and I get that. But I just think Pharma are missing a huge opportunity with podcasts.
Yeah, I think it's misconception of regulations sometimes. People are led by the fear of doing the wrong thing, even if the code doesn't explicitly say you can't do something. It's a common misconception that people think that any content produced by Pharma can't be accessible via a channel like Spotify, for example, which is not true. And even And if they, they can't use Spotify or something like that because there's a risk that a patient might access the content and they've deemed the content inappropriate, completely inappropriate or too promotional, then there are easy ways to work around that. But just to think about the user experience, I mean, it might be a little bit of a hassle, but, using an educational platform app or something like for podcasts, which can be downloaded and, which people could use for other reasons, would at least allow them to download that and store it streamable via the device. So there's loads of ways to work around that. Having it as just a player in the browser is just not, it's just never going to work. Or a massive file download, that someone has to download onto their laptop and somehow transfer across their phone, like they've got like an old MP3 player or something to do that with. So yeah, I think they are missing a huge trick. But to me, the big answer to this is like more about like, what is the content you're producing? Because if you're producing content that would be acceptable or reasonable for a podcast, it should be educational, conversational, insightful, should provide, experience and information from other clinicians, discussion-based content. Then technically you shouldn't be trying to sell your product in that content. It's not the right omni-channel space for it. It's the space to build trust, build engagement, get people to subscribe to content, push to a landing page or push to a website where they can access more specific clinical data and information, like you have in those nice educational audiobooks, that kind of thing, I think is what they need to be thinking about to get that right. Can we also talk a little bit about the images here as well?
Yeah, sure. So, okay, we've talked about topic line, a subject line. Can we go back up to slide 7 and talk about images? So subject line is really important. If it's rubbish, we're not going to open it. But let's just say you do a good subject line, then how does the email look inside NHS email? So getting emails delivered is actually quite a technical thing to do, and especially with NHS email, because inside NHS email, images are blocked by default, okay, because it's NHS, they want it to be super secure. So images are blocked by default. The two implications of that are, if you use images in your emails, they're probably not going to look very good. And the second problem is around tracking, because as you know, the pixel is how we track open rates and things like that. And if the pixel counts as an image, if the pixel is blocked, your open rates are going to be underreported. So we get around that by various pretty basic things. We get a specific landing page and we triangulate what our ESP provider tells us the open rate is versus how much traffic hit this unique landing page. And it's about a 20 to 30% under read on open rates. So that's just NHS technicalities. So what this email tells me is that someone sat around in a meeting, they designed an amazing email here. Maybe the title was okay, and they've led with an image, which is what everyone says, get an image in there, it'll grab their attention, it'll be really cool. But unfortunately, this is how it looks in my NHS inbox. Yeah, and even worse, right? They've named the image top banner, right? If you're going to use images, at least make the image something like, if you click this image, all your dreams will come true, right? I'm like, yeah, okay, I'm interested. But the image is called top banner. It's just like, no one has ever tested this email. And what I'm constantly saying to my staff in GP practice or everyone at Medics Money is just walk through the front door. So walk through the front door of my GP practice. What do you see? Is it easy to find out how to navigate things? Okay. And as a customer of Medics Money, walk through, you land on Medics Money's homepage, you sign up. What's the first email you get? How does it look? How does it look in your inbox? Is it relevant, right? Nobody here has walked through the front door as a doctor and has even tested this email in NHS email. Because if they had, they wouldn't have led with an image and above the fold image as well. It's just like above the fold. It's just, it just looks awful.
Yeah. No, I mean, the great advice. And especially even, okay, I understand like you want to put images in and that they're useful, but name them. So it's obvious that you want to have a look at that image or what does it say about the image? This is like a very common issue that I see and I also push for my own newsletters. It's like making sure that you don't just use the file name. As a designer, just name that top banner. And there it is, straight there, top banner. First thing you see, the headline of the email is top banner, which is, testing. Please test.
Please test. But also look at the signals, the top thing. This content has been blocked because it's not in your safe list, okay? Not much you can do about that, right? Except if you do a decent onboarding sequence and you encourage them to add them to your safe list, like that's pretty basic. That's something we do. Then that message goes away. And then the next thing is the message from NHS email. Do not click links or attachments unless you recognize it, right? So that's the first two signals you get. Then you get a viewing browser thing. Then you get something about a random medication. And then you get top banner. It's just like, wow, if you want to help with this, just email me, right? Email me the test. I'll show you how it looks in my inbox and you can make some changes based on that. Like, please.
Yeah. And I think also, just on the user experience side, I mean, people look at websites, they look at emails and content that they receive from businesses, and they make an assessment about the quality of that business as a result. And if you see something like this with, sloppy top banner content here, like just not been tested, you're going to associate this with poor quality, which is not the exact opposite of what a pharma company wants to be associated with. Even subconsciously, that's what you're going to think. You walk into an NHS practice and, the receptionist has paper all over the place. The place is a mess. You're going to make an immediate assessment about the quality of care you might receive in that practice, right?
This is your front door now. Like, this is what people see. They don't see your big shiny office or your corporate headed notepaper. This is what they see as a representation of your company and your brand, and that's how it looks.
Another solution to this.
Yeah. Okay. So I reckon like the first email that we just showed with the images, they all sat around in a design meeting. We're like, this is amazing design. It looks incredible, right? And then some brave soul put their hand up and said, I don't think we should use images. In fact, I think we should just use text. And I think we should actually lead with value. Okay. And I think we should actually target this emails really specifically so I'm a GP with special interest in dermatology, right? And this is an example of a company that is doing a pretty good job. Okay. There's no images. There's just good content that is relevant and appropriately personalized to me. And actually, this is a meeting that I signed up for because I was like, yeah, this looks pretty interesting. There's no images. There's nothing fancy. It must have looked terrible in the design meeting. And someone's gone and put their hand up and go, yeah, I don't think we should use images. I think we should use plain text in the email, which is, of course, exactly what you should do. But I reckon they probably went out on a limb for that one. And
okay, so let's talk about the beginning of the journey, getting people's attention, asking them to engage in your content as a long-term subscriber to content. And here's a good example of the type of thing that you're seeing from pharma, right? So this is a social post.
Yeah, so the good things about this are they've appropriately targeted me. That's pretty impressive. The algorithms are amazing. I think the value offering is pretty good. Like, don't miss out on early access. Like, okay, good. Bit of urgency. Exclusive webinars. Okay, that sounds cool. Expert led. Yeah, that's all good. And practical tools like strong first sentence. Register now to stay ahead. Okay, like, cool. I'm interested. And so then I click register. And if we go to the next thing,
Process.
Yeah, the process. Okay. So you want someone to do something, right? If you're like ordering an Uber, yeah, they don't ask you to fill in like an 8-stage form where they ask everything about you and loads of random information. They just put order now. If you're on a food app ordering food, you don't have to fill in 10 different questions. You just literally put buy now. And that's because we want to reduce friction. We want to make it super easy for people to do what we want. And so off the back of that quite nice social post is a 6-page form asking all kinds of questions. And then at the end, I've done all that. I've persisted. And at the end, it just says, thanks. We might send you an email in a bit. And then what actually happened at the back of that, email basics 101 is what's called a welcome sequence. And I said to Dan before we started, do you think we should say this because it's patronizing? But it seems not, right? So if you sign up for an email list, set a welcome sequence. You introduce yourself, tell the readers what they can expect, signpost to some of your best content, set some expectations, like we're going to email you every week with the latest news about finances for doctors. And then just signpost them into content. Okay, that's like the basics. At a more advanced level, you can introduce some targeting to that. So the first email might have one thing about, in Medics Money's example, investing, one thing about buying a house, and one thing about saving tax. And if you click saving tax, the email service provider realizes, okay, this person is interested in tax. We should send them more about tax. And they're not currently looking for a house, so we should not bombard them with emails about looking for a house. But even at a basic level, let's just do like a basic welcome sequence. Like, hi, we're pharma company. We're going to tell you about this, this, and this. You can access our content on podcasts if that's what you're into. You can read blogs here. You can watch videos here. And if you've got any questions, hit reply. Like, we would love to hear from you. We'd love to improve our content or learn about how we can help you more. Didn't get any of that. I just waited about 3 or 4 days. And then after about 3 or 4 days, I was getting bombarded with just all kinds of random, non-targeted promotional emails. And I've given them so much information. I've told them I'm a doctor. I've told them where I'm located. I've told them that I'm a GP. Like, don't invite me to a conference in Newcastle. I've just told you where I am on the South Coast. It's like 500 miles to Newcastle. So they collected all the information. They didn't personalize it. And they didn't even bother to set up a welcome sequence, which is like email marketing basics. And like I said, I thought it'd be too patronizing, but Dan said it wasn't. So blame Dan if I'm patronizing you.
I don't think it's patronizing because it is, like you said, 101. It's also omnichannel 101. I mean, farmers getting obsessed with like, using AI to get a 360 view of the third party and first party data they have, putting that all into an engine and spitting out recommended content. And it has spent 11 years trying to achieve this goal. And what you basically need to do is some basic CRM programming, like very basic, in order to get a welcome sequence going. So as you said, I think there's a few things to pick up on here. Like one, I can empathize with the challenge of the long sign up. Farmers have real struggle, like internally they have conflict over this. Most people don't want this long sign up process, but people will insist that they have it, and that they do have to qualify the person as a clinician. Usually that's a manual process, but there is tons of technology available to them off the shelf, which will effectively immediately qualify the person, test against the database, make sure that you're definitely an NHSGP. I know, just use a GMC number or something. I know, but they can easily do this very, very easily and send you a welcome sequence there. They can even send you a welcome sequence if they can't do that doesn't have any promotional or content on it, that just says at least thank you and what you can expect to receive, which is what they kind of say on this form. The second thing is they don't treat people like subscribers like you do, like you think about with your audience. They call it consent capture. And that's exactly what happened here. You went through a process like you were going for an operation, and you gave your consent to be harmed. And you then received all of that promotional content, got bombarded with it because you consented and you allowed them to do that. But what they don't do is treat you, again, thinking like a publisher. If you have a subscribed audiences, you should treat them well, send them regular stuff so they know what to expect in the same format, make sure it's relevant. And we always advise our clients as well, like about the interest thing. Product usually has like, maybe they have key messages, like 4 benefits that they really want to use to differentiate. Most of those benefits, if you flip them around, can solve a specific problem. So at least, in this case, I know it says topics such as cardiac or something. I think it said cardiology stuff. So at least they can get some understanding of like what type of cardiac patients that you're seeing sometimes, and then maybe they can do an email, like 3 different short email sequences to say what the recommendations are for those types of patients, like maybe send a case study and maybe introduce the product later down the line. But it's it's pretty basic stuff, and they all have the capability to achieve that. So everyone's asking for something nice and kind to achieve that welcome sequence. So hopefully they can take that advice and start programming them in.
I think you've just made a really important point there. The welcome sequence is important, right? And what we notice is that the time between you registering for Medic's Money and the time you receiving your first email, is inversely correlated to how likely you are to open that email, right? Because I've seen this thing. I'm really interested. I want to do it like right now, okay? I totally get from a compliance point of view why you can't start blasting me with promotional content, but why not send an email saying, much better ways to do this. We say, thanks for registering. We've sent the first email, which gives you a guide for GPs on how to treat cardiorenal metabolic disease. Open your inbox and click that link and, allow images, right? And then suddenly you're starting to get into this, overcoming those technical aspects. You allow images. That means now your images are going to get displayed. You're leading with value. You're sending me something which is actually useful and educational for me. It doesn't mention any product because you don't know I'm not verified yet. That's cool. And then follow that up with like, in a couple of days' time, we're going to send you some extra information about a specific treatment could help all your patients. It's like, I'm instantly interested. You've captured my attention on social. Now follow through and convert me to a different channel. This is like where omni-channel's going wrong. Like you got to convert me back. So send me that email, and your idea is brilliant. Like just send me a welcome sequence that mentions no product, right? It doesn't matter if I'm general public or verified. Once I'm verified, yeah, sure, put me on blast for every one of your products, but just do something. It's just like, I've been through 6 steps here. I've told you like my inside leg measurement, my postcode, like everything about me. And what do I get at the end? I get nothing. I go, if you're verified, we might send you some stuff. Like, cheers. It's like, oh, what a letdown. Like, I want something now, instant gratification. Give me instant gratification via email.
And I hope people take that advice, because the other thing is, honestly, as a person in pharma marketing, you're dealing with all these, all these internal politics and challenges. A lot of people will want to do this stuff, and they're just really struggling to pull everything together to do it, and it can be hard. But doing a welcome sequence is a really good investment because it also takes the pressure off. Right. If your welcome sequence is even say six emails that are once a month, and then in between that you're sending other things, you at least know your audience is going to be sent content once every month without you having to do anything. Right. And that's a big weight off your mind. People just get stressed about, okay, we haven't sent our audience anything in like 3 months because we haven't had time to create it and review it and get it approved. But if you have a standardized sequence, that it takes a massive load of pressure off. Personally, I do that, and people receive like 12 months of content, and easy, makes your life a lot easier.
100%.
So look, Tommy, thanks so much for sharing your experiences with pharma content. I hope people haven't felt like stressed or offended by the content, and there's been some good advice on how to improve it. So that's our little Christmas gift to you. I would strongly recommend, if you want to see how healthcare professional communities are managed really well and content is engaging, you should check out Medics Money website and podcast. And Tommy, I think you kindly give your contact details to get in touch if anyone wants any specific advice from you, right?
Yeah, like a Christmas gift to everybody, because like I said, I'm not here for fun. I'm here because I want to help pharma. So yeah, if you want me to roast your emails, just drop me an email. It's tom@medicsmoney.co.uk, and I'll help you because I want your products to reach more people. We've been working with other advertisers at Medics Money. Just go to medicsmoney.co.uk/advertise. There's some case studies on there of just like basic things that we've done to help other people reach more doctors. I'm also on LinkedIn, but I'm usually getting blasted by locum job opportunities in there, so you might miss your message. So yeah, thanks so much.
Yeah, cool. I recommend you do that. And if you want to see more of this content, or if you're watching this on social media and you see a short, head over to brandcasthealth.com/resources. I'll put the link below in the description so you can access that. You'll be able to see all the videos with Tommy, all the content, and we'll also put his website and details on there so you can get straight there. Happy Christmas. Hope you enjoyed the roast.